Ear pain, fullness, or ringing in the ear? Ear ringing, also known as tinnitus, often goes misdiagnosed, causing many people to suffer with it without getting the proper treatment.
Tinnitus and ear pain are often caused by issues with the jaw joint. In a healthy normal joint, the condyle of the jaw joint sits in the glenoid fossa with the articular disc in between, protecting from load and biting forces. But in joint dysfunction, like Temporo-Mandibular Joint Disorder, also known as TMD, the condyle is forced too far back, and over time, it pushes against the tympanic plate of the temporal bone, which houses the eardrum. The tympanic membrane is a thin layer of tissue in the human ear that receives vibrations from the outer air and transmits them to the auditory ossicles, little tiny bones, in the tympanic middle ear cavity. The membrane is well supplied with blood vessels, and its sensory nerve fibers make it extremely sensitive to pain. Trauma to the tympanic membrane can cause perforations in the membrane and result in pain, dysfunction, and ear ringing. If the lower jaw is locked in by the upper teeth, and in order to get the teeth to touch in the back when closed, the mandible has to retrude back, the condyle dystallizes. And this type of movement over time can cause damage to the posterior space and tissues of the jaw joint, and subsequently the ear. Many patients that suffer with TMD symptoms experience ear pain, fullness, or ringing. Most doctors won't consider this to be a symptom of jaw joint problems and often refer these patients to specialists like ENT and neurologists. Very often, with no neurological or ear infection findings, the most common treatment is prescription medication. The most frequently prescribed medications for unexplained ear pain or ringing are pain meds, anti-anxiety meds, antidepressant meds, muscle relaxants, and gabapentin. The challenge with this is that none of these drugs actually solve the problem. They simply reduce the pain, or they numb the patient so they won't care so much if they have the actual issue. Treatment for ear pain, fullness, or ringing, if caused by TMJ dysfunction, is correct diagnosis and treatment for TMD. Once the jaw joint is treated and dysfunction corrected, the ear symptoms will resolve on their own when the damaged tissue is allowed to heal.